Welcome back to the TMDSAS podcast, where we'll explore the TMDSAS application in greater detail by connecting you, the applicant, with the admissions experts who are ready to help. I'm your host, Enrique Hasso, Coordinator of Research, Advising Services, and Digital Media at the Texas Health Education Service in the TMDSAS office in Austin, Texas. Today we're delighted to have a panel joining us on the podcast from UT Southwestern. Can we go around the table to get everybody's introduction, your name and your title, please?
Sounds great. So I'm Dr. Kathleen Wilson. I went to medical school here at UT Southwestern. I have been on the admissions committee as a member since 2008. I'm the current chair, and I'm professor of pathology and genetics here.
I'm Dr. Dennis Burns. I'm a professor of pathology at UT Southwestern and also a graduate of UT Southwestern Medical School, 1978. I have served in various capacities on the admissions committee over the years, from interviewer to just prior to Dr. Wilson's assumption of duties as chair. I served as chair of the admissions committee for several years and am currently a full-time member of the admissions committee.
My name is Dr. Jim Wagner. I'm a general internist. I am also a UT Southwestern graduate, graduated in 1986, and joined the faculty and then joined the Student Affairs Office. I'm an Associate Dean for Student Affairs and have been so for the last 23 years and have served on the admissions committee in various roles since then.
Great. I'm Shauna Nesbitt. I'm professor of medicine and a hypertension specialist, and my title is Associate Dean of Student Affairs in the Office of Student Diversity and Inclusion at UT Southwestern.
Wonderful. Thank you all so much for joining us today on the TMDSAS podcast. We want to go ahead and jump in. We've got several key points that we want to touch on that really reflect the positions and the wealth of backgrounds that you all have. First off, could we talk a little bit more about the curriculum at UT Southwestern, what it's like, and what applicants might expect once they get admitted?
Sure, Enrique. This is Dennis Burns again. I can speak to that, having been involved in a major curriculum reform effort over the last 4 years or so. The new curriculum is something we're very excited about here at UT Southwestern. Southwestern Medical School has always boasted a very strong academic tradition, and for years and years we had a curriculum that was fairly standard for curricula in medical schools throughout the country. 2 years of basically preclinical work followed by 2 years of clinical work. Mm-hmm. We undertook a major reorganizational effort that actually started back in early 2014. Our goal was to take a look at the strengths of our existing curriculum, to also take a very honest look at areas where we might improve, particularly in response to changing demands being placed on the medical profession, to new educational modalities and so forth. To supplement our efforts, we visited a number of peer institutions to get our finger on the pulse nationally in terms of what was going on with curriculum reform. Mm-hmm. And we came back and as a group, a strategic planning committee, which I co-chaired along with 4 other members, and the support of many, many faculty and students and administrators, we put our heads together and basically decided to rebuild our curriculum from the ground up. In place of a traditional 4-year curriculum, while our medical school curriculum is still 4 years in duration, we have divided our curriculum into 3 major parts. The first 18 months of our curriculum is what we term our pre-clerkship curriculum. The pre-clerkship curriculum begins with some traditional basic science topics, a lot of focus on basic human structure, the components that go into making up individual cells, the biochemical processes that are part of our lives. This introductory phase, this basic phase, if you will, lasts for about 6 months. After the winter break, that is followed by a 12-month period that we call Integrated Medicine Health to Disease. In the Integrated Medicine curriculum, we go organ system by organ system and basically include material that is included in traditional first and second year medical school curricula, that is normal to abnormal. This is supplemented by giving our students exposure to some clinical activity in the form of their academic colleges. Dr. Wagner is very closely involved with that program and can give you more details about that. But this Integrated Medicine Health to Disease course continues from January until December. That culminates with a 3-week course in December called the Foundations of Clinical Reasoning that introduces our students to things very relevant to subsequent medical practice, biostatistics, laboratory errors, human errors in medicine. Dr. Wagner is also heavily involved in that course and can give you more details about that if you're interested. Following the 18-month pre-clerkship curriculum, the students enter an 18-month phase called Growth and Exploration. The Growth and Exploration phase includes our traditional core clinical clerkships, which in the old curriculum were held over basically the third year of medical school. So this was 48 weeks worth of clerkships tucked into a 52-week calendar year. What this expanded 18-month program allows us to do is to take these same clinical clerkships, the core clerkships, and to intersperse them with electives and other scholarly activities, giving the students much more flexibility in terms of exploring specific areas of interest, taking electives that they might not have taken until very late in their careers in the old curriculum, and basically begin to shape their career pathways. An additional activity, besides the electives and the core clerkships that we have in this growth and exploration period, is a new program called Scholarly Activities. Students are given a 12-week period during this 18-month phase to conduct an activity, a scholarly activity in an area of specific interest. There's a broad menu of options available. These include topics like basic and clinical research, translational research, medical education, global health. It's actually a fairly impressive list. These activities are completed at basically the end of that 18-month period, at which point the students enter into their post-clerkship period. This is a 12-month period that is really the final year of 4 years of medical school. During the post-clerkship period, students have opportunities to gain additional clinical experience with electives, special electives that we call selectives, and in addition, some special courses, one block of courses called Frontiers in Medicine. Students have an opportunity here also to choose from a very broad menu of subjects, again, tailored to their evolving interests. Topics like neoplasia, topics like resuscitation medicine, topics like central nervous system disease and developments. Again, kind of an exciting list. There is also a course that they will take, that all students will take, called the Physicians in Society. The Physicians in Society course will introduce students to healthcare economics and financing, to medicine and the law, all topics very relevant to the practice of medicine in the 21st century. The final offering in the fourth year is a Transitions to Postgraduate Training course. I don't want to use the term boot camp, but you can think of it as an intensive training period that will prepare our graduates to face the realities of life as a recent graduate when they start their first postgraduate year. year, formerly called the internship year. So that's a look at our curriculum. Basically, our goal was to provide a curriculum that provided better integration of material, that eliminated unnecessary redundancies, and that gave our students much more flexibility in terms of exploring areas of interest and formulating their career plans under the guidance of appropriate mentors.
I think that's very reflective of how medicine's been changing, and it's not just a one or two person activity anymore. It's much more integrated, and there are a lot more areas of specialties that can be explored once you're in medical school.
Oh, yeah. And in fact, you've touched on something very important there, and that's the area of interprofessional education. I think all of us have come to realize that the old days with the physician as the captain of the ship, sometimes functioning almost independently, are a thing of the past, that successful healthcare delivery, that optimum patient care demands a team effort. And that's one of the things that our curriculum is also designed to promote.
Wonderful. Thank you very much for sharing all that.
Thank you.
So I believe this question's for Dr. Wagner. We have a little bit of a setup for you already with what Dr. Burns touched on, but could you walk us through the progress of a student, kind of their cycle once they've matriculated all the way through the point when they graduate?
Sure. Enrique, it's fun in my position to watch the evolution of the student as they go through the curriculum that Dr. Burns just described. They come in very enthusiastic, but very green and naive. They know that they're going to be exposed to something and it's going to be voluminous, but they really don't know the half of it or even just a fraction of it, because what they will be exposed to is really life-changing, and just in the sense of how the students are learning how to take care of patients, and then ultimately will be involved in life and death situations and decision-making in the care of those patients. So they come in green, and they know that they've got a lot of facts to learn, and they focus on those facts, and and grades and test scores become very important to them. But as they learn more about patients and as they get involved more in patient care, that really kind of melts away, and their true focus of patients and their well-being and taking care of them in a high-quality way, as that becomes their focus, that's when they really start becoming physicians. And we see that happening in the latter months and semesters of the curriculum that Dr. Burns has described. So it's really quite fun to see them travel along that journey, and it's fun to see them look back at younger versions of themselves when they look at, when they're graduating and they look at the underclassmen and wonder, gosh, was I really like that? It really is a transformational process. It's fun to see from where I sit, and but it really is a life-changing process.
So our next question is for Dr. Nesbitt. We want to make sure that our students are aware of the challenges that are ahead for them in medical school. Would you mind telling us some of the common issues that students have once they're in medical school and how our applicants now can start working to avoid them?
Sure. I think some of the issues that students have once they get to medical school is that they underestimate the size and the volume of work that they're going to have to encounter. Mostly medical school is, it's not so much that the level of work is so difficult, it is the amount of work that becomes the greatest challenge, and really setting yourself in a place that you can balance the amount of work, how much time it takes for you, understanding your own method and what is most successful for you, and then also having time to take care of yourself. All of those things become a new juggle, if you will, for students as they enter medical school, mostly coming from the college environment where they've had usually more time to do multiple things. Medical school really requires that you first hone in on what's your best study skills And that may take you, the first month or so to sort of figure that out. They may be different than what you have done in the past. And secondly is to make sure that you build in time to take care of you, because an unhealthy you is not a successful you. So you need to understand what are your needs and how do you get that balance of wellness and mental wellness, physical wellness and mental wellness, so that you understand your stress points and what do you do to de-stress that, and then be willing to really reach out for help if you need it. But mostly it is starting out from the very beginning, understanding that everybody needs some level of off time and how to offload the stressfulness that you'll have to encounter.
And that's actually something that even translates into practice. We want to make sure that our doctors are able to take care of themselves so that they, in turn, can take care of others. Absolutely.
This is the training grounds for what will become your life. This is not a boot camp that you will pass over and never use any of these skills. This is really teaching you how to manage life plus work all at one time and to maintain your happiness through it. And it's a step up from where you have been, but that's okay, because we're all on a journey to be something very unique and to have this very wonderful opportunities to be a part of people's lives. And you want to be healthy as you enter that space, so that you can not only tell people about what's important about the physiologic processes and the pathophysiologic processes of the disease that they have, but you can also be a bit of a self-witness of how to overcome some of the struggles that your patients will have to endure.
Dr. Wilson, would you mind giving us a glimpse into the components of a successful interview?
Certainly. So there are a number of components of the interview. We are interested in getting to know the applicant in a holistic way. And the interviewer is also there to be a resource for the applicants. I will be engaged extensively in about 6 weeks in orientation sessions for our interviewers, because we're very interested in our faculty who participate in our interviewing process to be able to be utilized by the applicants as a resource for the activities and educational opportunities that we have going on here at UT Southwestern. So it really is a two-way street. The types of components that we're interested in from the applicant, of course, involve an academic component that all institutions are interested in. We are interested in how well the applicant did in school academically, and so there are objective metrics that are utilized by all institutions that constitute a grade point average. We certainly focus on the rigor of the institutions where students have been and the rigor of their coursework, their majors and other types of coursework, and how that constitutes their GPA. And we also look at their MCAT scores. So these things are definitely important, because we want to admit individuals here who will be successful. We want all of our students to be successful. The curriculum that Dr. Burns just described is quite rigorous, and we believe prepares you very well to be a physician, and we want individuals who have an established academic record that we think will be able to be receptive to it and do well with it. We are also very interested in personal attributes, so how well the applicant did out of school. These types of things can be a wide range of activities, demonstrable in their interview process and also in their essays and their letters of recommendation. And so we're interested in what types of things the student did for extracurricular activities. And again, this can be wide-ranging, related to athletics, related to different types of community service activities, related to travel, all sorts of different things that are components of that particular person. We want to get an idea of the whole person. Another key element that's very important to us in the application as a whole, and definitely during the interview, is we believe that if you are interested in going to medical school and sincere about it, we need to have some coherent reason of why you want to go to medical school. We need to see a clearly articulated mission, and that needs to come across in the interview and also in your essays. This can also be a wide-ranging type of factors. It can be, I took care of my grandmother when she had Alzheimer's disease, and I learned a tremendous amount about the physicians who helped us, about myself, about my family, about the healthcare team, about the beauty of my grandmother's life, all of those kinds of things. It can be someone who is fascinated with basic science, who spent a summer in a basic science laboratory. I'm fascinated by DNA and the potential that's there to cure disease. Maybe I'll be the next person to develop the chemotherapeutic agent that's the next personalized medicine agent. So all of these types of things are legitimate motivations and missions for attending medical school, but it needs to be stated in some clear way that has some consistency to it. Secondly, we are interested in how well the applicant understands the pursuit of the medical career. So their motivation, have they had reasonable healthcare exposure? So they can articulate why they want to go to medical school, but have they actually engaged in a process where they have educated themselves about what that might be like? And the best way to do that is through healthcare exposure. And so over the course of the interview, the applicant will be asked about the types of healthcare exposures that they have had, and we like to see some sort of consistent record of demonstrated healthcare exposure. And again, these can be diverse opportunities. It can involve shadowing, can involve different types of hospital volunteerism, it can involve different types of community service activities, some through a blood bank or the Leukemia and Lymphoma Society, all of these types of things. But we believe it's important to come across in the interview why you want to go to medical school and that you have actually engaged in some process where you have learned a little bit about what it might be like to be a doctor. And then lastly, here at UT Southwestern, we're interested in particular in aspects of their motivation, of their intent to go to medical school that align with the missions in particular of our school, of UT Southwestern. So we are asked by our legislature to encourage and have provision for applicants and ultimately graduates to practice in underserved areas. We still have large areas out in West Texas in the Valley that have an absence of primary care physicians, sometimes entire counties. And those of us involved in the admission processes across the state here in Texas, we would like to help address that and remedy that. So individuals who express interest in underserved activities, underserved areas are something that's important. Other parts of our mission include interest in primary care, interest in academics, and research and teaching. And so when we see particular applicants who have developed expertise in some of these particular areas, we certainly like to hear about that in the interview also. So those are the kind of key components: how well the applicant did in school, out of school, and then the whole manner of how they state what their mission is, why they want to go to medical school, and what they have done to demonstrate education about the healthcare process.
It's very interesting how you kind of brought all of the topics that Dr. Burns, Dr. Wagner, and Dr. Nesbitt discussed in their questions, and how those apply at the application phase when one is going through the interview process. It's really interesting to see all that come together, and the end goal of providing the most effective health care for the populations that need it.
Thank you.
In the admissions world for medical school, we do encounter quite a few myths here and there. People post questions, and just about everybody will give you a different response. And so we'd like to offer you the opportunity, each of you, to address a common myth that you've heard about the admissions into UT Southwestern, or any myths about the institution itself.
Well, Enrique, I appreciate the opportunity to try and bust this particular myth, but I'm not going to flatter myself in even thinking that or hoping that any words I might say may bust this myth, because I've come to learn over the last 23 years that no words out of my mouth are going to bust this myth, but I'm going to give them to you anyways, just in case. And then I'm going to tell you the one thing that I think will truly bust this myth. The myth that I'm talking about is the myth that students at UT Southwestern are cutthroat. Now, to me, cutthroat is somebody who is so interested in their own performance in relation to everybody else that they will do things to sabotage their classmates. And if that's the definition of cutthroat, I can tell you that that is not what happens on this campus, because our students, when I was a student and for long as I've been a faculty member and in student affairs, have always clamored for ways to collaborate and help each other. They want shared drives on the network where they can put the tables that they've used, that they've created while synthesizing the material that they're learning. They want to share that with everybody. They sign up in droves to help tutor the classmates that are struggling with some of the material. It's a very collegial, very helpful atmosphere. And if you think about it, it makes perfect sense, because the reason these people want to be doctors is because they want to help people. And they can easily help the people closest to them, in fact, sitting next to them in the carols, if they understand something that that person sitting next to them doesn't. So it really is a collaborative and not a cutthroat environment. Now, I've been saying that for years, and I've learned that there's only one thing that will really debunk or bust that myth, and that's actually coming to school here, because that's what our students tell us, is that, I always heard that UT Southwestern was cutthroat, but when I came and interviewed, I saw that it really wasn't. Or when I came and was enrolled as a student here, I was amazed how helpful everybody was to me and how much I wanted to help everybody. So that's my attempt in this podcast to try and bust that myth, and I appreciate the opportunity.
Absolutely.
So one of the myths about UT Southwestern is that there is a lack of diversity, and the diversity is not supported, and that students who are of minority backgrounds or different backgrounds don't feel as though their support is as strong, and that is clearly a myth. The diversity at UT Southwestern encompassing underrepresented minorities is at about 23%, which is quite high for medical schools across the country. But it is more than about numbers of underrepresented minorities. This is really about diversity and inclusion, because we endeavor to not only have diverse backgrounds and faces in the group, but we also want every single person in the group, in the class, to feel included, because it's important for not only those of diverse backgrounds, but for every member of the class to help them to learn about how to manage patients, how to understand people who have different viewpoints or different backgrounds than you. Part of that is the engagement with your classmates. The second part of it is that the UT Southwestern patient base is one of the most diverse backgrounds of patients in the country. Parkland has every ethnicity, every language that you can imagine, and every walk of life that you can imagine come through our doors, either at Parkland or at the University Hospital. Uniquely advantageous to students, because they have to learn from all of these patients' backgrounds, but it's also incumbent upon us to make sure that we support that. And our students, I can tell you, are not only well supported, but they're happy. They engage with each other. They engage with the community. They're active in doing multiple things that celebrate the diversity that they all come from, without begrudging that experience of being different. And it's really a wonderful thing to watch them support each other in that way.
Mm-hmm. That's really fantastic, because I have myself heard that myth, and I love the fact that you brought up Parkland. For those of our listeners who aren't very familiar with Parkland, that's the hospital. It's almost right across the street from the medical school. How large is that hospital? Parkland
is one of the largest public hospitals in the country. servicing, more than 100,000 patients per year, and the number of beds is 560 some beds, which is just a huge hospital.
It really is.
And frequently, we have been in the last several years amongst the top 3 hospitals for baby deliveries in the country. So, the likelihood that you would be there as a student and not take part in a birth is almost zero. Everybody gets an opportunity to be a part of it because there are so many babies being born and there are so many patients coming through. To give you an example of the diversity at Parkland, in a given morning, I saw 3 patients in a row, and all 3 patients spoke 3 different languages, none of which that I personally speak, but we have support services to walk through that. But it is just to show you that these patients are incredibly diverse. The depth of learning that you will get between really all of our clinical exposures is immense, from children's to the university hospital, which is also growing to, also will eventually have actually more patients than Parkland has, if you can imagine that. And the VA hospital, it's an incredible experience as a student to learn from that environment.
Enrique, this is Dennis Burns again. As you recall from the introductions, we're all graduates of UT Southwestern. When I came to UT Southwestern, actually for my first visit as a prospective student in the early 1970s, that was a myth that existed, and I came for my visit knowing that was the case. And I was very pleasantly surprised by the warm, welcoming atmosphere that existed back then. Dr. Wagner mentioned students liking to share things on various drives. The only drive I knew was my beat-up Nissan car that I drove around. We didn't have computers back then, but the atmosphere from the time I first visited Southwestern Medical School, through my application process and through my experience here as a medical student, was anything but cutthroat. When I came to Southwestern Medical School as a student, I was sharing this with a very young medical student earlier today, I really felt that I had come home. It was an atmosphere that made me feel that I belonged. This isn't to say that the atmosphere wasn't and isn't rigorous, and I think some people will make the mistake sometimes of equating academic rigor with this cutthroat term. But that's simply not an accurate reflection of what we're all about at Southwestern. We are here to support students, those of us involved in education, and there are hundreds of faculty who are very deeply committed to educating students. Our students' well-being in education is a priority. Even when hard decisions are involved regarding students, we make those decisions with the students' interests at heart. And I'm very proud of what we continue to do here in that regard. I have spent most of my academic life here at UT Southwestern, and this is a tradition that I'm very proud of here.
This is Kathleen Wilson. So the myth I would like to debunk is that at UT Southwestern that research is a requirement for admission. So we admit many individuals who have not had basic science research experiences or any kind of, often any type of organized clinical research activity. We do have many applicants who have some of that background, and as I previously stated, it is aligned with one of our missions, which is research and teaching. But again, we are also interested in applicants who have missions associated with the other types of things that I was talking about related to primary care and related to underserved areas. So prior research experience is not a requirement at UT Southwestern for admission.
Thank you very much for saying that. I know I've definitely heard that myth on my end. And I think that goes to speak that, regardless of which institution a student wishes to attend to become a doctor, medical schools aren't looking for a cookie cutter version of of a doctor. We're looking for individuals who can really take the profession and help as many people as they can within their own abilities and their own interests. And I think you've really touched on that quite well. Before I let you all go, is there any final advice you'd like to offer applicants?
Enrique, I think that Dr. Nesbitt's probably going to say something about this, but the advice that I'd like to give applicants to medical school, regardless of whether they come here, is that it's very important to stay balanced in one's life when they come to medical school, because it's very easy to not be balanced. It's very easy to make decisions that cut short important parts of one's life. So, of course, it's important to manage one's time adequately so that they can master the material that they must learn to take good care of patients. But it's also important that they balance their expansion of their mind in that way with taking good care of their body and their soul in whatever way that means to them. Staying in shape, being fit would be what I think of in terms of balancing the mind with the body and then mind with the soul. Some people find religion, some people find arts or relationships as a way to kind of enrich that feeling of the soul. But I think it's important for students to keep that in mind, that balance is important, because if one is balanced as a medical student, they're going to be balanced as a physician, and that balance is going to keep people in the profession and engaged with their patients in a very positive way.
So I think that in preparation for medical school, there are a few things that are key. One is to really examine your own passion and be absolutely sure that this is what you want to do as an individual, because life is long. This isn't an easy profession, but is incredibly rewarding if this is what you'd want to do. And I think if you spend time really taking part in care and observing folks and talking to people who actually do it, you'll have a better understanding of whether it suits you and if you're willing to give that much of yourself to do it. Second is to prepare yourself, really prepare yourself for the amount of rigor, for the amount of time that you are going to have to sacrifice to get what you want. And it really does require that you put your life in order, so to speak. That is to think about how will you be financially set up for this. Think about your life and the people in your life. Make sure that they are also ready to be supportive to you and that you're not splitting yourself in too many different directions while you're trying to attend medical school. This is a full-time job, absolutely, through and through. And finally is to enjoy the journey. Get yourself to the point where you are really enjoying the act of preparing and learning for learning's sake, not learning just to have a certain GPA to get in. Obviously, that's necessary, and it's necessary to achieve a good score on the MCAT exam. But you should be learning because you really want to learn, and you're happy to do it, because this career is a lifestyle of continuous learning experiences, and that should be something that you enjoy doing.
Advice I'd like to give to applicants involves the fact that we are interested in getting to know the entire applicant throughout the course of all the process, involving the essays, involving the interviews. And we like to hear from the applicants with an honest and authentic voice. It is often clear to us, in particular in the essays. I know there are many things on the internet that you can extrapolate from, and we have a lot of experience reading essays. And the manner of how we hear about the applicant and the things that are important to him or her in a very honest and authentic way that rings true to us, and again articulates in particular these issues related to motivation and mission, is something that's very important within the application process and important across your medical career. So I think an authentic voice is something that should be emphasized in the course of the entire application process.
Yeah, this is Dennis Burns again, Enrique. Let me just add one other thing. It's really kind of an expansion, I think, of what Dr. Wilson just mentioned. My advice to applicants is to look very honestly within yourself, to look at your motivations. Somebody else's motivation that you become a physician isn't sufficient horsepower to propel you through this course. Students need to take a very sincere look at what their motivations are. When they fill out the applications, we really like to see as an admissions committee more than just a fill in the blanks, a checklist, I've done this, I've done that, and so on for X number of hours. We really want a sense that students have explored what it means to be a physician as well as they're able to before coming to medical school, and again has developed a sincere internal commitment to that goal. That may sound like kind of silly advice, but I do see applicants who come to us who I think don't have the internal motivation that it really takes to be a successful medical student and physician. There are many ways to help people. There are many careers out there. Medicine isn't the only way. Medicine has some very significant demands that it places on an individual. So again, honesty with oneself is I think something that I feel very strongly about.
Thank you for sharing that. Well, thank you all so much for taking the time to talk to us and sharing your wisdom with all of the applicants out there.
Thank you, Enrique.
Thank you.
Thank you, Enrique.
Thanks, Enrique.
Make sure you subscribe to our podcast on iTunes, Google Play, or wherever you listen to podcasts to stay up to date with us. Follow us on Facebook at facebook.com/TMDSAS and at Twitter at TMDSAS and at TMDSAS Support. On behalf of TMDSAS, we want to wish all our applicants for the 2018 cycle all the best of luck. Thank you very much for listening. We'll talk to you later.